Most people wonder, why should a young man or a young lady go for a general checkup? In many cases, most of you will probably be engaged and want to get married. And before starting a long relationship of this nature, in which you are going to be producing children, and it's really necessary to have a general checkup. In this situation, certain diseases, if detected early enough, can be either treated completely or prevented from causing an effect on, say, the child who is developing in the young lady. We have conditions like HIV, and knowing the condition, that HIV status will help us make important decisions. Other conditions include hepatitis B, hepatitis C. They are also quite common in our society, and you cannot know that you have it until you do a blood test. Syphilis is also a common disease in our societies here, and it affects the child if not treated. We've got a condition called congenital syphilis, but if seen or spotted during the checkup, treatment is available which can totally eradicate syphilis, and you have a normal baby born even if you had syphilis. Our bodies have blood groups. They are divided into A, B, AB, and O. And then there's another factor found on the red cell called the rhesus factor. When you have a blood group A, you will have in your blood antibodies against blood group B. These are innate systems that help us protect ourselves against foreign invasion into our bodies. And the rhesus factor, although is either positive or negative in each blood group, but it's so important because if, for example, you have a rhesus positive husband and a rhesus negative wife, and however the baby in the womb is rhesus positive and the mother is rhesus negative, the mother will have antibodies against the rhesus positive baby in her womb. So that pregnancy is considered a high risk, in that we have to monitor that particular pregnancy to make sure that the antibodies in the mother's womb do not cross and attack the young baby who is unborn. This results in neonatal jaundice and a lot of other complications as a result of this condition. So checking up for rhesus incompatibility is another of the tests that young people or couples should take before getting married or before pregnancy. Another condition that is common in our society is sickle cell disease. Sickle cell disease, as you know, is a condition whereby the red blood cells in the blood are sickled. What forces them to become sickle disease were low levels of oxygen in the blood, things like that. However, it's a genetic abnormality of the structure of the sickle of the red blood cells. Sickle cell disease occurs when someone who has a sickle cell carries another person who carries the sickle cell. And their combination thus produces a completely sickle-celled child who usually has a very difficult life from birth and doesn't really live very long in many cases. This is preventable by knowing if you have a sickle cell carrier or not. If you are a carrier, we would advise that you don't marry someone who is also a carrier, so that you produce children who are just carriers other than sickle cell disease manifesting in them completely. Other diseases that could occur in families, though may not present in youthful, include things like hypercholesterolemia, which is a condition whereby you have high levels of lipids in the blood. Some kidney diseases are initially transmitted. And apart from those, the other can actually be eliminated by a checkup before marriage.